So after talking in detail about the non-neoplastic benign tumors of the larynx, let's move to the other classification, which is the neoplastic benign tumors of the larynx. In this, we will talk about the chondromas and haemangioma, granular cell tumors, glandular tumors, and benign laryngeal tumors, which are rare. So the neoplastic benign tumors of the larynx, we have chondroma, haemangioma, granular cell tumor, glandular tumors, rare benign laryngeal tumors, squamous papilloma. So these are all the neoplastic lesions or tumors of the larynx. The squamous papilloma, we have again juvenile papillomatosis or respiratory papillomatosis. These are one type of squamous papilloma, and then we have adult onset papillomas also. So squamous papillomas, further we have juvenile and then adult onset papillomas. So one by one, let's go over the neoplastic type of benign laryngeal tumors. Chondroma. Chondro is the cartilage. Chondro is the word part used for the cartilage. Oma is the tumor. So this is the tumor that arises from the cartilage, and the cartilage is cricoid cartilage. This arises from cricoid cartilage. Also on thyroid or arytenoid cartilages. So it arises on the cricoid cartilage, arytenoid cartilage, and thyroid cartilage. In subglottic area causing dyspnea, sense of lump in throat, and dysphagia. So it is present in subglottic area below the glottis, and it can cause difficulty in breathing, and also there is a sense of lump present in the throat, and it can also cause dysphagia. As a result of that lump in the throat, there is difficulty in swallowing, dysphagia, difficulty on swallowing. It affects men 4 times more than women in age group of 40 to 60 years. So men are more commonly affected by chondroma 4 times more than the females. So chondro is the cartilage. It arises from cricoid cartilage, arytenoid cartilage, thyroid cartilage. All these can give rise to chondroma. Diagnosis and treatment, that's the picture of the chondroma, and then the diagnosis by CT scan and biopsy. Treatment is carbon dioxide laser, excision by laryngo fissure, lateral pharyngotomy approach. Otomy is the opening, lateral pharyngo through the throat, lateral pharyngotomy approach, and laryngectomy. So these are some treatment options for the chondroma. Next is the haemangioma. Hemo is for the blood, so hemangiomas from the blood vessels, tumor that forms. So infantile hemangiomas involve subglottic area like chondroma, which also affected subglottic area, and it presents with stridor 6 months of life. So at 6 months, it presents with stridor, and it's the infantile hemangioma. 50% cases is hemangiomas elsewhere in head and neck area. Tracheostomy relieves the respiratory obstruction. So hemangiomas can be present in head and neck. In the infants, mainly it involves the subglottic area, and then obstruction can be relieved by performing tracheostomy. mainly capillary type and can be vaporized with carbon dioxide laser. As with chondroma, carbon dioxide vapor can also use with hemangiomas. Then adult haemangioma, we said infantile haemangioma which caused stridor in 6 months. Adult haemangioma involves the vocal cord or supraglottic larynx. Infantile subglottic, this is supraglottic, above the glottis. Cavernous type, that was capillary type, this is cavernous type haemangioma, cannot be treated with the laser, left alone if asymptomatic. So if no symptoms, no dyspnea is present, no obstruction, no hoarseness, we can leave it alone and no treatment is performed. If the larger ones, if they have symptoms present, then it's treated by steroid or radiation therapy. Next is granular cell tumor. It arises from Schwann cell and is often submucosal. So granular cell tumor, here you can see the granular cell tumor, and this arises from the Schwann cells. Schwann cells are the cells that covers the nerves and is often submucosal. Overlying epithelium shows pseudoepitheliomatous hyperplasia, resemble well-differentiated carcinoma. Treatment is removal under microscope. So these granular cell tumor arise from Schwann cells and they resemble well-differentiated carcinoma. Pseudoepitheliomatous hyperplasia is present and the growth are removed by the microscope, under the microscope. Recurrence can occur. If the excision is not completely done, then the recurrence can occur. Glandular tumors and benign laryngeal tumors. So glandular tumors arise from the glandular tissue, so pleomorphic adenomas or oncocytomas. So glandular tumors can be adenomas or oncocytoma. Rare benign laryngeal tumors include rhabdomyoma, neurofibroma, neurilemoma, lipoma or fibroma. So we have glandular tumors which are adenoma and oncocytoma. Then other type which is the rare benign laryngeal tumors are rhabdomyoma, neurofibroma, neurilemoma and lipoma or fibroma. And that's the picture of the benign laryngeal tumor. So all these are the different neoplastic tumors of the larynx, which we have the granulomas, glandular tumors, some other rare benign tumors, rhabdomyoma, lipoma, fibroma. So these are the neoplastic type of lesions or tumors of the chondroma, haemangioma, so different types of neoplastic benign tumors of the larynx. Remember that the symptoms associated with them mostly are the same as depending on how big they are. They can cause dyspnea, they can cause dysphagia, hoarseness of the voice. If symptomatic treatment is required, if not, we can wait, and then we have different treatments and different diagnoses for the different types. So that was all about the neoplastic tumors of the larynx. Thank you for watching sqadia.com.